I'm always happy to talk about HPCC Systems and the value creation it brings to the community. Today, I'll be talking about cervical cancer risk factors. This is a study examining factors associated with cervical cancer. I worked on this research with Dr. Itauma Itauma. Exploratory data analysis can be described as the first step in analyzing data sets to visualize and draw unique insights from the data. Let's start by answering this question. Some causes of cancer-related death in women worldwide. The results will be shared at the end of my presentation. Cervical cancer is a leading cause of cancer-related deaths. Among women, with about half a million new cases worldwide in 2018, about 90% of cervical cancer deaths occur in low-resource areas. These deaths could be reduced through effective prevention, screening, and treatment programs. HPV vaccination reduces cervical cancer risk. However, not all populations have access to HPV vaccination. Cost for complete vaccination can be up to about $500. An exploratory analysis of a cervical cancer dataset with data visualizations was performed using HPCC Systems with data visualizations in Tableau. The findings from this study could be beneficial in areas with limited access to cervical cancer screening and HPV vaccination. As of the time of this research, I was teaching a course on data visualization using Tableau at Southern New Hampshire University and wanted to show my students how to spray their data on HPCC Systems and create a data connection to Tableau. However, the visualizations can be created in HPCC Systems using the visualization bundle as I previously presented in episode 12. This can be done from queries written in ECL as seen from a previous research. The visualizations shown on this slide are all done in HPCC Systems. Visualizations are a great way to convey information from massive data. The objective of this study is to explore risk factors and protective factors for cervical cancer using HPCC Systems. Factors such as age, HPV, cigarette smoking, IUD use were examined. A data set containing the identified medical records of 858 randomly selected female patients who attended the GYN service of a hospital in Venezuela between 2012 and 2013 was explored. This data set is publicly available on the Machine Learning Repository website. The data set included patient information such as age, number of pregnancies, smoking history, contraceptive history, STD history, including HPV, and cervical cancer diagnosis. The dataset was sprayed to HPCC Systems cluster, and a web connection was made to Tableau for data visualization. Visualization techniques were explored to understand the association between variables. As can be seen from the chart, the patient's ages range from 13 to 84 years. Cervical cancer occurred in patients aged 19 to 52 years, consistent with literature findings where cervical cancer is rare in patients younger than age 15. Regarding cigarette smoking, the incidence of cervical cancer was higher with a longer average per year of smoking. HPV infection was found in essentially all cases of cervical cancer with greater than 1 per year of smoking. As can be seen on the histogram, longer duration of IUD use appears to protect against cervical cancer and HPV infection. The orange represents cases with HPV. HPV infection was noted in cervical cancer cases with a shorter duration of IUD use. The scatter plot shows that the longer the use of IUDs, the lower the number of STDs noted. The larger cycle depicts cervical cancer cases. No cervical cancer cases were seen with greater than 10 years of IUD use. Findings on data visualizations were consistent with published literature findings about the protective effect of IUD use on cervical cancer. More cases of cervical cancer were seen with a longer average per year of smoking and HPV infection. In low resource settings where contraception is desired, IUD use may be of benefit with possible additional protection against cervical cancer. Exploring connections between various data visualization tools such as HPCC Systems would increase the engagement of users on various platforms in the data visualization network, bringing increasing value and promoting a healthy data ecosystem. This concludes my presentation. Thank you for listening. One more poll question. What are the risk factors for cervical cancer? Thank you again for listening to this presentation. Are there any questions? Now I'll hand over to Jessica. Thank you again.
All right. So while you take a look at the questions from the audience that have come in, I'm going to go back to our very first poll question, which was cervical cancer is a leading cause of cancer-related death in women worldwide. And it looks like everyone said it true, 100%. I think it helps that it was on the next slide, but we're thrilled that everyone was paying attention and selected true. So that is wonderful. All right. So let's go to the questions from the audience. It looks like we've got a few of them that are in here so far. Let's see. Okay, here's the first one. If one were to quit tobacco, then what effect would there be, or would there be a reduced risk of cervical cancer?
Thank you for the great question. So it's outside the scope of this study, but there's literature that shows that the risk decreases after quitting tobacco smoking.
All right, good. Thank you.
You're welcome.
And of all the factors that you've mentioned, Itauma, which one has the strongest effect on the risk of cervical cancer?
HPV infection, that's another great question. HPV infection has the strongest effect on the risk of cervical cancer.
All right, perfect. So it looks like there's another question that's come in. Itauma, could you talk a little bit about the machine learning algorithms that were used?
That's also another great question. So this study focused more on the visualization component, the visualization of data. So the visualization bundle of HPCC Systems was used, and not the machine learning algorithm, and there was no machine learning algorithms used for the data exploration. So the visualization bundle was what was used, and also the objective again of the study was to show that we can create a data connection between HPCC Systems and Tableau. So visualizations were also done in Tableau as well.
All right, it looks like another question just popped in. Could you talk a little bit about your other research projects that you've used HPCC Systems for?
Great, that's a wonderful question as well. One of my first projects that I did using HPCC Systems was during my master's program at Wayne State University, where I explored I classified a lot images. I did image analysis using HPCC Systems. It was an unsupervised. I used a K-means algorithm, which the next thing to talk about, to classify large-scale images. And for that research, I used a machine learning library of HPCC Systems for the project.
All right, wonderful. I think I remember that you had some information online. I don't know if you still do, Itauma. Is there a place where somebody could go and learn more about some of the research that you've done?
Well, yes. So the codes that the ECL codes used for my master's project are available on GitHub, and yes, so that's where it's available.
All right, so check out GitHub. All right, perfect. Itauma, while you take a quick peek at the questions,
okay.
And if anyone else wants to send in another one, I'm going to take a quick look at the votes from your last poll question, which is what are the risk factors for cervical cancer? So this is a little bit of a quiz. We have HPV infection, cigarette smoking, age, and all of the above. And we've got 80% said all of the above, and 20% said HPV infection. So, Itauma, what's the correct answer?
The correct answer is all of the above.
All right, perfect.
They are all risk factors.
Yeah, definitely. So, Itauma, it looks like there's one more question that's come in, and I think it probably has to be our last question. But the question is, as someone from academia who's been using HPCC systems for quite some time, do you have any advice that you could give to students wanting to leverage the platform for their studies?
That's a great question, and really that's what I've been pursuing for quite a while right now, how to encourage students to work on with the platform. And to that question, last year I had a student of mine at Wayne State University, an undergraduate student, who was able to utilize the platform to come up to work on a project in which she was looking at the associations of chocolate, eating chocolate versus longevity. So I think HPCC Systems is a great platform that cuts across the various data analytics life cycle, from data wrangling of data to data exploration to data analysis, data visualization, etc. So any student any statistics student as well would find the platform very useful in data analytics, in machine learning, across different domains, even in health analytics, as you can see from this presentation. So it's all about the problems one is trying to solve, and there are various use cases that one can formulate for students in which we utilize the platform. The benefit of the platform is that it's used for solving big data problems, and the algorithms you write in terms of also the beauty of the program is that the student learns just one language, which is ECL, Enterprise Control Language. It's a wonderful language to learn, and I highly recommend students learning the ECL language, as the last speaker would show us the beauty of ECL. And I think it's a great platform that students can leverage in their studies across various fields.
All right, thank you so much, Itauma. We really appreciate you being here with us today.